morning. I'm Dr.R.Priyadharshini from the Department of Costume Design and Fashion and Drsnsrcas for the Arts and Science. So this is about video, like a case study video. We are going to learn in this class. This is about the topic. The whole topic is about technical textile. I think everyone know about technical textile. It is a very broad field of textile. In this technical textile, we are having 12 different stages are there. It starts from agro, geo, home textiles, and it ends up with protective textiles and so on. There are 12 different textiles are there. So here I have come up with a medical textile. Okay, so I have come to the platform. I have given a case study belongs to the medical textiles. Okay, so let us move into the subject. So here I am giving a case study of wound care, advanced wound care case study I have given here. So we know in our population, in our world population, more than 1 to 2% of consumers, they are having a patient, they are having this kind of chronic wounds they are having. So I think you people out there know about wounds. What's the name of wounds? Wound. That is when we met with an accident, we are getting a wound in our body. So that is a wound. Okay. So chronic wounds nothing but the wound. It will take a long period of time to cure. That is a chronic wound. Okay. So for this kind of wounds, we have to go to some specialized medical textiles. So what will happen? This kind of specialized medical textiles, it will cure the wound very soon. Okay. And we know when we go for a chronic wound, preferably they will go for a traditional textiles, traditional wound curing process, like dressing process. What is dressing process? So we have to clean the wounded area. We have a cover and the protection what we are giving for the wound, that is called the dressing. Okay. So usually we are going the dressing. We move to the dressing for 1 or 2 days for the hospital, and once the wound is cured, we have to stop with the things. Okay. So from all this, we are using hydrogen and we are using antibacterial testing. Everything we are using in the wound care. So these hydrogen and antibacterial will become a game changer in the wound care. Okay. I explain what is the hydrogen, and you will get an idea about that. So hydrogen testing, it is the most often used for burn wounds, but also for traumatic wounds, ulceration and bed sores. So traumatic ulceration, bed sores, what is meant by this means? When bed sores is nothing but a patient laying on the bed for a prolonged period of time. That is a bed sore. Okay, that person having like some kind of pimples or some kind of a wound in that rested portion. Okay, that is one. And traumatic is a very big accident. Due to the accident, what you are getting a big amount of damage in your body. That is a traumatic. Okay. And burn wounds we know when the heat applied to the body, you are getting some burn wound. That is the thing. So for all these things, we can use a hydrogen dressing. It will cure the very soon and very good when we compare to the dressings. Okay. And due to the consistent flexibility, they can be applied in any place of the body, and we can place. Okay, we can place the hydrogen in any place of the body. There is no restrictions in that. Okay. And taking out the hydrogen dressing is very simple and painless also. Okay. When we are injecting, it is very painful. When we are doing some other traumatic operation, it is very painful. But using this hydrogen dressing is not a painless. It's a painless. Okay. You can use it very soon. Okay. And hydrogen is also offer pain relief and also can manage chicken pox. During chicken pox, we are getting some kind of pimples in our body itself. Okay, so using this hydrogen, we can remove that kind of marks also. Okay. So when it comes to antimicrobial textile, it's nothing but nowadays in the gauze itself, we are using the antimicrobial textile to cure the wound very soon. Okay, so we have the gauze. So the gauze we have to make with some antimicrobial textile we have to apply. So what will happen in this textile? It will apply to the wound. Not at all the hydrogens or any ointments we are using the wound. And also this antimicrobial gauze also, it will help the wound to cure very soon. Okay, that is the concept here. Surgical wound also we can remove it very soon. And the case study here, the clinical case diabetic ulcer treatment. So we know ulcer patient, very soon they will go with some kind of wounds. Okay, we can cure it, but it will take long period of time. So for this reason, we can go with this kind of hydrogel and antimicrobial. It will help them to cure very soon. Okay. So in the study, we are having 80 patients. So we have taken into two groups, hydrogel plus silver plus gloss. We are using both the things. Okay. Faster heal 10 to 14 days plus 21 days to 28 days. Okay. So when we are using gloss, otherwise when we are using hydrogel, it will be very easy for them. Okay. So when we are using gloss, it will take 21 to